So the pro tip is from 4 to 7, I kind of don't need to worry. I could just make like a scrapbook.
Right. No, you have to be there. I'm telling you that when your kids are older and you need to remind them of everything you schlepped them to in the formative 2 years where they remember nothing, you need evidence.
Got it.
You have to show them, look, I took you here. I did this. We did this. We did this. We went here. I took you on vacation. We did all these things.
And also, I feel like you can also do a couple little lies. Like you could be like, I could be like, I changed the most diapers. I feel like I can like, there's little white lies sometimes that I can like narrate and manipulate.
Well, I can also, I'll be like, man, I really wish your mom was there when you were younger. It was just...
That's a good call.
Oh,
damn fighting words.
So I was telling you off air that I was dying to get both of you in the studio at once because, as you know, we do a him and her podcast, and you guys are also very much him and her.
Yeah.
And I think that I told you I'm a huge Housewives fan, but there's a lot of stuff that you know, and I feel like there's a lot of education that we can benefit from in the audience.
Yeah.
First, I would just ask you both how you became interested in health and human optimization to begin with.
Well, I mean, I'll let Terry answer his side, which is a little more obvious than mine. But, you know, being married to a doctor, I like to say I have like a little MD, married to doctor. I mean, the kids will call me before they'll call him if something is wrong or they're sick. But, you know, for me, it's always been so far the non-surgical solution to anti-aging. And as I'm getting older, going through menopause, you know, I want to stay, look, yes, I'm vain. I want to stay looking good, but I also want to be fit. You know, we had our kids a little bit later. I want to be that grandmother, you know, with the kid on my back, you know, with a grandkid in a backpack, you know, hiking around and doing all those things. So for me, it's about vanity. It's about longevity. It's about strength. It's about all those things. And, you know, having Terry as a husband, obviously, that's a lot.
Yeah, I mean, for
plastic
me,
surgeon.
Yeah, so obviously I'm a plastic surgeon, but it's what's happened, as you know, in the last many years is that we've sort of made these discoveries. You know, in the same way that sort of AI is changing our world, these GLP-1s are changing our health span and our understanding of how to avoid sort of surgical procedures. And, you know, as the botch doctor, I'm very into teaching people, hey, you really need to know that if you have plastic surgery, you can have a disaster. It's much more common than plastic surgeons will tell you. So it's funny because if I went to med school in the 80s, okay? And if you would have told...
I was very young, by the way.
And if you would have told me...
You were born.
You know,
being born.
40 years later, we're still... I graduated in 86. You would have told me in 2025, you're still going to be taking a scalpel and cutting through the skin, taking a scissors and dissecting out the blood vessels, lifting things up, pulling it off, pulling it back, cutting off and putting stitches. I would have gone, no way. It'll be done with lasers or energy transmission devices. Nice? Longevity and health and wellness will be completely different in 40 years. And it is and it isn't. But the things that I'm really focused on are how is it and how can we advance the frontier? Because there's so much BS right now. There's a lot of stuff that works, a lot of stuff that doesn't work at all. And then there's a big question mark stuff like NAD and peptides and this multi-billion-dollar industry for health and wellness that there's no science behind. So we're really super focused on what works, what doesn't, what's new, how can you advance our lives. And
Lauren, you mentioned before we started, you mentioned our first book. We've written 3 books together, and our first book was Dr. and Mrs. Guinea Pig.
Yeah, that's the one I love.
So we are resurrecting Dr. and Mrs. Guinea Pig, and we are trying, again, all things health, wellness, and beauty on ourselves. So
have you done the NAD yet?
We have not done NAD yet.
We're coming up to NAD.
We're coming up to
so
that.
you're doing like a new version of the book.
Advice.
Yeah, but we're doing it on YouTube.
That is genius.
On ourselves.
On ourselves. And we are testing things.
But are really testing things.
Creatine. I'm sure you guys take creatine. Mm-hmm. I mean, it's the one supplement that everyone agrees everyone should be on.
I've been taking it since I was 12 years old.
Really?
No issue.
But have you heard about megadosing creatine?
I have.
For the brain.
And if you don't sleep well, you do. And it does. It helps.
Well, we tested it.
So does it,
like
though?
Well, you have to watch.
Okay.
Because there's real science behind the 5 grams or 7 grams or 3 grams that a male or female would take for muscle and for fitness. But every science influencer right now is saying megadosing is amazing for your brain. Based on what? What science? There's no science there. So we are actually putting all of these things to the scientific test on ourselves.
Can you give us a few things that don't work that you both think are not
I
it?
don't even have to look at him. I know exactly what he's going to say.
What?
Well, I mean, she wants me to say salmon sperm
That's
facials.
what I thought you were going to say.
Oh, no,
I
Lauren.
love salmon sperm facials.
She loves it.
I think that they are incredibly good. I think it's your skin is glowy and amazing. I love it.
But I mean, who concepted this thing? I have an idea. Let's get the ejaculate from a salmon and wipe it on our face. That's going to be really good for our skin. What? You just know.
You never know what's going on at Pornhub. You never know. Maybe they
was-
did a bestiality.
But isn't it? It's
It was
something-
born on OnlyFans.
It's the
Fish edition.
exosomes that they're trying to get right. Is that
Those do
like-
work pretty well, I must say.
So I get it's like the salmon semen. I always, at least when you made me do it, you told
I
me it
made
was
him do it.
exosomes. I didn't know if I'm just getting a fish
a
Right.
facial.
little lie. Like I
Yeah.
said, a little lie.
So I can tell you, in my opinion, and this is controversial, but I think every plastic surgeon would agree with me, threads don't work.
Oh,
Agreed.
yeah, he doesn't like threads.
They don't work.
We've had a lot of people in your space come on and say that those can be not only not work but disastrous.
Explain why.
So, I mean, they've been around forever. Okay. And I will tell you, when there's a technology that was in the 70s and 70s and goes away, 80s and goes away, 90s and it doesn't work. And so now the new version of it is sort of these barbs that are on these threads. You
It's like
put
a
them
fishing
in,
hook.
fishing hook, multiple fishing hooks. You feed them in, they sort of grab and anchor the skin, and you pull it up and you let go. And hopefully they'll stay up, and they just don't work. I think they do work in the right hands for about 4 weeks.
But like that's a lot of trauma to your face for 4 weeks.
And I can't
Heather,
tell you how
I
many
so
patients
agree
I've
with you.
seen with obviously I have a complications type practice. You know, I'm the botch doctor, but so I only see pretty much disasters of everything. They don't work and they don't last. Even when they work temporarily, they don't last.
So
And with
people
every-
come to you and once it's happened and it's gone wrong, and they, Terry, we
There'll be like this weird pull on one side and this one fell and this one's over here. So what did the doctor do to fix it? Put in more.
And I have friends that have done this, and you have to get them done constantly.
When you're in Orange County and you're surrounded by I think you're in a unique position because you're surrounded by Terry, who's a doctor, who sees all the botch stuff. And then you also, in Orange County, everyone's doing everything. And so you get to see it up close in person. What is that like to sort of be in the middle and have Terry as the doctor, but then have what's happening in real life in front of you?
You know, it's funny. I think that region to region, plastic surgery is so different. I mean, girls from Florida look different than girls from Orange County, that look different from women in New York. I mean, I think I'm from New York, so I feel like we're always bundled up. So it's really about the neck up, you know, there. And in California, people care more about breasts and now butts and stuff like that.
But Orange County is even different from LA. I moved
Yeah.
my practice up here.
We moved back
in
to
Beverly
LA.
Hills now.
Okay,
We
I
live
went
up
to your
here.
Orange
and, you know,
County.
we grew up in
Yes.
San Diego.
Oh,
And
really?
then we came here in like 2014, and now we're in Texas. But we grew up in San Diego, so like kind of experience with we get all the vibes of the
How-
different.
Yeah.
Different in Texas.
How is Orange
plastic
County
surgery.
different than Los Angeles?
So I think Orange County
It's
is
more coastal.
yeah, and more body oriented. A lot of
Yeah, it's a beach community.
and a lot of sort of larger implants and
bigger
lips. I think
Yeah.
LA is becoming a lot more, just like Hollywood's settling it. There's a lot less pillow face. By the way, in terms of that thing, what doesn't work? Filler, too much filler doesn't work. Okay, I've done too much filler on me, and it was very embarrassing.
Oh my
in the
God,
media.
that went on for like 2 years.
Yes, I did.
I don't like filler. I
Yeah.
like Sculptra.
Yeah. So, and I
Huh.
have a show on Ian Peacock right now called Botch Presents Plastic Surgery.
Already
Rewind.
watched it. Check. Loved it.
Look how many celebrities regret their filler. All of them did pretty much, right? They all wanted it dissolved. So I think the pillow face filler thing is gone in LA. I still think it's big in Orange County, the too much filler.
And to answer your question, I think for me, not just what I see, but you know, being married to a plastic surgeon. First of all, being on television, high definition
It's hard. That's hard.
television.
It's so stressful.
I'm 56. Like I've been on TV since I was 22. Man, the cameras have gotten very clear.
No, you look so good.
That's so nice of you. But I watch back and I go, that's not a good angle. Or is it time? Is it time for a facelift? Is it time to get your eyes done? Is it time for all these things? And I really try to, move forward and see where I'm going to go. But I like the non-surgical stuff, but there will come a time, I'm sure, where I'll want to do something surgically. But it is hard, because there's so much perfection out there, or what seems to be perfection, that you don't know if it's filters or it's like the perfect surgery or whatever it is.
And then the final thing about things that don't work are the things that work kind of, but they're exaggerated.
Like what?
So the most exaggerated thing are the radio frequency or energy transmission devices that go under the skin that are going to give you a facelift without having a facelift.
Right.
They're going to
nothing
tighten your body
tightens.
skin, the face tight, body tight, the
Like the Morpheus 8s.
the Morpheus 8, the Ultheras.
Yeah. I've done those.
They work.
And
They
Okay.
work kind of, sort of,
Ish.
but
I don't want an ish.
they're way
I'd rather
exaggerated
just-
in their effects.
What do you guys think about how The Cut just came out with this article, and I thought you were the perfect people to ask. It's called like the Forever 35 face.
Yeah.
Yes.
What is both of your opinions on that?
So it's funny. We were just talking about that today because that's what this phenomenon where you don't age,
Right.
you're locked in at 35 is now, I think it's looking good for some recent celebrities who have had facelifts and are admitting to it, this sort of plastic surgery acknowledgement. Oh, I've done this. The admitting of plastic surgery
It's
in
called
females.
strategic relatability.
Right.
It's cool. And also nobody has
Stars,
to question
they're
them and
just
bug
like
them
us.
about it.
Give us the
But-
real list.
But just in the last few days, and I'm not mentioning names, but you'll know who I'm talking about, there's been some males in that stage of life that have attempted to have the Forever 35 face. And it's not only is it not Forever 35, it's like, where did you park your spaceship kind of face, because it looks altered.
So let me ask you this. I have not done very much. I've done like some Botox, and but I want to do something eventually because I got these. My eyes one day are just. I'm going to
Do
be
you
like.
want a consultation with
No,
Terry?
yes, of course. I'm going to
Okay.
take every opportunity I
Yeah,
can.
go ahead.
What would you do if you want to age gracefully and not
Yeah.
completely fall apart? Because I know at some point, like this is coming down.
Yeah.
And
So for a man, it's good to have low brows. It's okay to have a little excess eyelid skin. You do not want to take in a woman. Let me look at the eyelids here. Right there's no upper eyelid excess. Look at the eye. You guys.
I'm going to be able to use this as a sleep mask, Terry, if I'm not
okay,
careful.
but
Right?
if you take even a little too much,
It's
you're
weird.
good.
You look feminized. So
You look
that's the
feminized.
problem.
And there's a male celebrity who just did this, and they're talking about it in the media, and it's really, they look completely different, and you don't want to look different.
No, I don't want to. Yeah, that's what scares me about it. Is I want to look at myself in the mirror,
Yeah.
but I also don't want to just be, man, that guy fell apart.
So
Right. But there's females like that too that they're known for hooded eyes, and they went and had their eyes done and they took too much skin, and all of a sudden it's not that they didn't look good, they didn't look like themselves.
Yeah.
So you want to be natural for you, but the Forever 30 thing sort of belies that concept. I have a mixed relationship or feelings about the Forever 35. I mean, first of all, I get a lot of comments. I'd like to say that I'm aging backwards, which is very nice since I haven't done plastic surgery yet. But listen, I don't look like those Forever 35 people because I haven't done that yet. And it looks so great. And there's a piece of me that's like, wow, I love that. And then there's another piece of me that thinks, well, if I don't do that, I'll get all the roles in all those shows and movies because everyone else is going to look 35.
That's an interesting point. I knew you guys would have an interesting take on that. It just seems like that 30-year-olds are questioning whether they need a facelift now.
Yes.
Because what
That's
I'm hearing and from all my friends is like, start early. Like, do it when you're 30 and 40. I have a friend who's like in her early 30s that has had a facelift. Yeah. These girls are doing it.
We know multiple people.
Yeah,
like
they're
that.
doing it.
So
In
do
their
I.
early 30s?
Yeah, they're
Oh, yeah.
also, I have another
Would
friend.
you ever do that?
On myself?
No,
little too
on
late for that.
someone in their early 30s.
So, I have consults like that all the time, and I take them to the mirror and I go, let me just show you something. I go, does this look better than that? And I go, look, this, that. I go, you probably should wait 5 years. But here's the thing. You go to a plastic surgeon, they see you as a pre-op. They see you as a car payment. They see you, they're not, they
It's a
want to operate
business.
on you. So they're not going to tell you honestly that maybe it's better to keep doing some judicious Botox and filler and maybe some lasers and maybe some energy transmission before you go for the facelift.
So
That's
you
what-
don't
you're
think
young, that-
30s and 40s should be looking into facelifts yet? Because a lot of people are doing little nips and tucks. They say like it's better to like start younger. So then by the time like you're 70, you're not having to like pull everything
So,
back.
I think I
That's-
do in
that's
some
the
cases.
conversation, I
In some
swear.
cases, I think it's good. In some cases, I do. The answer to that is always it depends. If you do look significantly better when you look in the mirror and do this, you can have a mini lift. I don't think it's a bad idea necessarily.
Is there
But
a quota to how many facelifts someone can have in their life?
No, not really. To be
Really?
honest with you, no. I mean,
All right, then start at
here's
20.
the truth is, once because we don't pull it back in a very natural way. We pull it back sort of up and back. So if you have too many, when it starts to relax in sort of the way skin in their natural relaxing tension skin lines, it's called. If it drops a little bit in an abnormal way, it starts to look very weird. And once you get to weird, it's hard to get out of weird.
Oh, that's scary.
I know.
And that's that like look
scary.
where you take
That's
it.
why I don't do anything.
It doesn't
That's
exist.
artificial.
It doesn't
yes.
exist
And
in
you know
nature.
who-
Oh,
talking
I know
about.
who you're talking
Yeah.
about. Yeah.
It's
Yeah, then doesn't exist in nature look is the weird.
It's weird.
That was what terrifies me. I would never want to do something and then have that.
If you take too much eyelid skin on a guy, it doesn't exist in nature.
Don't you guys also, I have this weird theory that like there's trends in plastic surgery. So like Pamela Anderson, she had the huge boobs.
Mhm.
And the problem is if you have that now, someone can look at you subconsciously and tell how old you are. So what I worry about with the facelift is let's say like the trend is ABCD right now and you get a facelift. And then by the time you're 60, you're sort of pigeonholed into that trend. So you look 60 subconsciously. Does that make sense?
Yes.
It does. It reminds me of Heidi Montag, who's a gorgeous girl. But if you remember years ago, she was very young and she had so many procedures done. And she went from like this really adorable 20-something-year-old to looking like a very gorgeous, exotic 40-year-old. And she was still 20-something,
Right.
right?
Right. And then what I wonder is how does that age when you're 60? Because then you're pigeonholed at how plastic surgery was at that time. It's almost like, remember like Heather will know what I'm talking about, like a fake French tip from a certain period.
Yes.
If someone was wearing that right now, you would like
It
look
would date you.
65 or something.
That's a good question. So would your plastic surgery date you?
Yeah, I think if you start too early, you have too many. Like I said, the main thing is when it relaxes, it goes weird, hard to fix. And if you're a guy and you're 70 and you have a very tight neck and a very snatched, they call it jawline. That's the word they're using these days. You look snatched.
He didn't know the word snatch. We had to teach it to him. They know the word snatched.
Okay,
by the way.
I just
Right?
heard
Yes,
that
thank
one.
you.
Anyway, I thought it sounded like a dirty porn thing.
That's what,
snatched,
when
didn't
she
it?
first started saying it, I was like, I don't think we're saying the same thing here.
Right?
I said it to the kids. They're just, yeah, do you know this word? I'm like,
Yeah.
okay, bucko.
And so, if you have a guy or a girl who's 70 and they have no laxity, it just doesn't. There's a discordance. It doesn't compute
Yep.
visually.
But that's
because
the
they
whole-
still look. And I mean, although Dolly Parton still looks really good, but I wonder what she looks like with all the makeup off. And she's sitting at home. Is there that weird? Thing?
I think though that's like Dolly Parton.
That's
Like,
part of her thing.
Yeah, I feel like there's like something about a essence with her that I don't know. That's like it's hard to like give the general population that tip and compare it to her because it's like that's Dolly Parton.
Mm-hmm.
But
You know
I
what
will
I
say
mean?
for
Listen,
Cher,
Dolly
it's
Parton's
worked.
always been hot. I'm
Yeah.
telling you,
Yeah, I agree. But
for sure.
for Cher, it's worked.
Yeah.
For sure, it's worked.
Yes, she doesn't look odd, and even though she's, what is she, 70?
Maybe
More.
she just got a little pull every single year, just a little tug.
It doesn't look weird. It does not.
And I think
But for most people, trust me, it does.
Do you think like it's maybe some of these like it's the drastic nature of the change? Meaning like if you just do a little bit here and there, it's and slowly over time.
always little, but there's certain things you should do, and Terry will tell you in your 20s, in your 30s, in your 40s. But to your point, Lauren, everyone's backing it up.
Right. So it's I don't know what the right answer
Backing
is.
up meaning they're starting way too early now.
I think way too early. We were just talking about mommy makeovers.
Yeah.
And what I was telling you was, so I have 4 kids. And after the last one, I was like, oh my gosh, like these children have sucked the life out of my body,
Yeah.
literally and physically. Like, and my chest, I used to have these full natural D breasts.
Best breasts ever.
That's why you didn't want her to do anything. Now it's mapping out. I
When
get it.
I met her, she
I
had
had them
these,
when I needed them.
these mid to full D cups with this most insane body. It was like heaven, you know. It was like
Thank you,
Calm
dear.
down, Terry.
I know, it was insane.
We'll talk
Terry's
later.
gonna jump you into your media.
I was so into it. Remember the honking
We'll step out
incident?
for a second.
Anyway, so after I had the kids, they completely deflated.
Yeah.
And I was so upset about it. And we talked for like 5 minutes about me getting implants to like small ones to get my upper fullness back. But I'm allergic to everything, latex and plastic and all. So I was like, oh my gosh, these will just jump out of my body. And if that hadn't been true, I may have gone and had it done. But what I'm going to tell you is within 2 years or 3 years of having that last kid, my body bounced back.
Yeah.
I'm not saying I have the same breasts I had before I had kids, but I mean, he's happy.
Yeah. I mean, she was very, very deflated and very lax. And she said, maybe I should put a pair of implants there. I totally was against it, even though I'm a plastic surgeon, because I just didn't want to. I was against it because, first of all, this like,
Look at him like already touching them.
besides, okay, that was TM. But I was against it because, truth be told, which plastic surgeons won't tell you, there's a 15 to 20% chance of a complication when you put a foreign body that's in there for a long period of time. Your immune system does a surveillance, and ultimately it goes, yeah, no, I don't like you anymore, and forms scar tissue. So you're going to have more surgery for sure. And I didn't want her to go down that path. As it turns out now, just so you know, and your audience knows, there's a new implant called Motiva that has a very low capsular contracture rate.
Why?
Are you telling me to get them now?
No,
Okay,
your breasts
good.
are great. I don't know exactly why. It's got a light texture to it. And they sort of, I think they broke the code somehow. And the body seems to be, it only got FDA approved since November. But it's been in Europe for 10 years. And we've heard about it this whole time. But the FDA doesn't let us use stuff from Europe unless we test it first. But yeah, I'm having amazing success in difficult patients who have recurrent capsulation, putting those in.
Huh.
So if you are going to do it, I recommend you do Motiva.
So, but are you saying based on those stats, like if 100 people got this, 15 to 20 of them would have a complication?
Could you imagine that out of every 20 operations I did, every 100 operations I did, 20 patients were totally unhappy? I wouldn't be a busy plastic surgeon. That's a lot.
Right.
Once you get to 1,000, you've got 200 plus patients running around who are regretful and super unhappy. So the complication rate in plastic surgery should be 1 to 3%, not 15 to 20. And I didn't want her to go down that path with implants.
If you guys were to tell someone what the perfect size implant is, what do you guys think it is? Or is it obviously different for everybody?
It depends on your breast
Okay.
tissue.
Yeah, it depends where you start.
Okay.
But
What do you think is the most popular?
It's regional.
It used to be,
It's regional.
I think it's
So
in
interesting.
Orange County,
It's bigger.
it's probably 450 to 500 is sort of the average.
Okay.
Up here, I think it's 300.
What's
is
in
the
New
average.
York?
You know, 300 is sort of like this big, you know.
I feel like New York's smaller.
New York definitely
Yeah,
small.
more
I'm sure it's
understated.
probably 250, like
Yeah,
that.
Orange County, they got some
And just for
big
your,
ones down there.
I know, and just for your, well, at the beach, right?
Yeah.
And just for your reference point, 15 cc's is a tablespoon.
15 cc's is a tablespoon.
Oh,
So
wow.
10 tablespoons is 150. 20 tablespoons is 300. It's not that huge, 300. But once you get to 500, 600, you know, you're getting, and the larger you go, the greater the chance the body's going to go, no, I don't like this. That's too much. And the other thing we didn't mention, she's very, very sensitive to anything.
I said that. I'm allergic to plastic and latex
Yes.
and all that. Yeah.
Yeah.
I'm telling you, they just would have jumped out of my body.
Yeah.
You think so?
Yes.
She would have encapsulated
100%.
within a week.
But
Oh,
Terry's happy,
for sure.
so that's great.
Yeah.
Yeah.
You guys have talked openly about GLP-1s, and I would
Yes.
love to know him and her perspective on
He's
GLP-1s.
obsessed.
You're obsessed.
He's
Obsessed.
obsessed. Yes.
Explain, like, why
obsessed with talking about it or obsessed with
The-
implementing?
This is
Both.
like,
he's obsessed.
you know,
Okay.
AI is to the fourth industrial revolution
Mhm.
as these GLP-1s are to health and wellness.
Whoa.
Yeah.
And are you talking just about like the semi-glutides? Or you're just talking about peptides in general, or just
No,
GLP-1?
he's talking about
GLP-1s,
semaglutide.
GIP. I'm
Okay,
talking
okay.
about these intestinal hormone, gut hormones. That's what they are for weight loss. So I got so obsessed with these drugs because they were initially used for diabetes. And people were noticing that these diabetics who were on them their weight was very low. And I had a friend who was a diabetic about 10 years ago, and he calls me up about 5 years ago and goes, I don't know, I have no problem with my weight anymore. And then, of course, we find out that it was on the weight loss drugs. But I'm so obsessed with them that I actually studied for a year and took the American Board of Obesity Medicine certification exam. And I'm board certified by the American Board of Obesity Medicine.
That is so
now.
my husband, by the way.
So I know everything about these.
So when he comes home and tells you this, are you, like, I feel like you have like a beautiful figure. Are you like, I want to try it? Or are you like, no thanks?
No, I would love. So, okay. I've been, thin for a long time.
Yeah, you've got naturally thin body. I feel like.
No, well, I used to be voluptuous before I had the kids. Literally,
Okay.
I had bigger boobs, I had hips, the whole thing. But after having the 4 kids, my body changed. My waist got wider, and my chest got down, and I turned into like a more athletic body, and I started working out like I never had before.
You taught me about strength training before anyone was talking about it. You guys talked on your podcast, I want to say 7 years ago or something, about weightlifting.
Yes.
Before anyone was talking about it.
And I totally believe in that. But now at this stage of my life, I still do weightlifting because you have to. You need it for bone density and all the things. But now I'm off of HIIT training and on to Pilates and core and zone 2 cardio.
But still,
as
we
Terry would
recommend
call it.
resistance training
But
big time, 3
weight
times a
training
week minimum.
Always.
Okay.
Yeah.
Always weight training.
So you love them.
I love them. So let me tell you just a little bit about them. So initially they were indicated, they were FDA approved for diabetes, type 2 diabetes. Then they got very fast, rapid approval for weight loss when it was discovered that they're so effective for obesity, which is the number 1 risk factor for all top 4 causes of death: cardiovascular disease, degenerative disorders, diabetes, and Parkinson's and things like that. So, and cancer. So then it was discovered, oh my gosh, they're not only good for obesity, they seem to prevent Alzheimer's. They're very good.
Cardioprotective.
They're cardioprotective. If you've had a heart attack, even if you're not obese, it's recommended you go on them to prevent post-myocardial infarction complications. They're good for liver health, kidney health. So it's clearly due to the sugar control. Sugar
because it's all
in
about
your blood,
inflammation,
even if you're
we've talked
thin,
about for years.
Yes.
sugar causes inflammation. So what I talk about, what I'm obsessed with, is microdosing.
Okay, so what's the right microdose amount?
So nobody really knows. This is like the peptides and the NADs. Everybody's using them. Many of us doctors who are specialists in this are recommending them, but there's no great science about it. So in my opinion, I'm on Mounjaro, and I don't meet the obesity criteria to get Mounjaro. So I'm on off-label. Botox, by the way, on the forehead is off-label. I don't know if you know that. Botox here is off-label. Botox here, it's only on label for right there.
Huh.
So most of what you take these drugs, any drug for, is off-label. So
When you say off-label, does that mean it's not FDA?
it's not FDA. It doesn't meet the indications.
Okay.
So on label is you have to have a BMI of greater than 30.
Understand. So on the
Yes.
FAQ, got it. So you're taking an off-label amount of Mounjaro.
Mounjaro. Well, it's tirzepatide, as you know.
Okay.
So tirzepatide is the GIP and GLP, right?
Okay.
So GLP-1 is Ozempic and Wegovy. That's the first one. They're the same drug. They just renamed it Wegovy for obesity indication. Then the better one is the GLP-1 and GIP, which is called generically tirzepatide, which is Mounjaro and Zepbound. They're the same drug.
But now there's a new one.
And what milligrams do you like to take of tirzepatide?
So it's tirzepatide. I don't know. I shouldn't
You know
correct
what?
you.
I'm known for not being able to
No,
pronounce
everybody
anything.
says try. Everyone says
I
it,
can't
but it's
pronounce
T-I-R.
We have
Anyway.
doctor friends that say it that way too.
Yes.
Say it how you say it.
T-I-R.
Tirzepatide.
Tirzepatide.
Okay.
So you start at 2.5 milligrams for 4 weeks, 5 milligrams for another 4 weeks, 7.5 for 4 weeks, up to 10 or 12, and then 15 is the max.
But that's not microdosing.
But that's for diabetes.
That's a full dosage. if
That's
you're
like
right.
you're
Okay.
never going to, once you get to 5, if you're a responder, which most people are, you're not going to eat at all. If you get to 7.5 and you're a regular responder, you're going to lose too much weight. So for me, I did 2.5 for 4 weeks. I lost that 6 pounds. And then I went to 5 for 1 week and I didn't feel well and I didn't want to eat anything. So I went back down to 2.5. And I consider microdosing 2.5. But people are talking about 1.25.
Or 2.5 every other week.
Or 2.5 every 10 days.
It seems to be like a secret sauce you have to figure out.
You have to figure it out for yourself.
One of the most important things in my daily life is my spirituality practice. I take it very seriously, and it's something that I do every single morning and every single night. So I start my day with it, whether that's listening to my morning meditation when I'm on my like vibrating plate and brushing my teeth, or whether it's meditation, or whether it's laying on a red light bed, or whether it's winding down the night. I've integrated it into my day every day. And the reason that I do that is because I am big on the subconscious and reprogramming it and manifestation. So a couple weeks ago, we just had the owner of the Higher Self app on our podcast, and it was amazing. She basically talked about how you don't need years of therapy to shift your life. You can clear a money block, even a weight block or a relationship fear in just 20 minutes. And she launched this app to do just that. So this isn't a meditation, it's more of a subconscious reprogramming, which is backed by science. For 53 cents a day, it's very affordable. You can go on and you can clear a block in just 20 minutes. Like I said, am all about the mind. It's so important to me to hit that box daily on my daily to-do list. Like, yes, I want to work out, and yes, I want to eat healthy, and yes, I want to go on walks and really kill it at my business and being a mom, but I always love to get my mindset right. And that really starts with subconscious reprogramming. Go to www.thehigherself.app/skinny and get 4 months free or 30% off the yearly plan. That's literally 53 cents a day to reprogram your subconscious and completely upgrade your life.
Quick break to talk about Symbiotica. First, I want to congratulate my friends over at Symbiotica because they are now at Target and all these Target stores. It's an incredible thing to see this brand's growth, and it's no surprise why. They have such a wide assortment of incredible products that Lauren and I have learned to love and take on a regular basis. What I love most about Symbiotica is they are intentional about the products they create. Sherveen, who's our friend and who's been on this podcast 4 or 5 times, is a wizard in the lab when it comes to supplementation. And what I also love about this brand is that most of their supplements are liposomal, which means you're actually eating the supplements like food. They're being absorbed in your body in a different way. They're being absorbed so efficiently in your body because of the liposomal delivery system. Some of the standout stars that I love and cannot live without is their liposomal glutathione. Glutathione is so important. It's been making news more and more lately. It is the master antioxidant for the body. It's going to help with anti-aging, your gut health, glowing skin, faster nutrient absorption, and it comes in this berry flavor. Usually glutathione is terrible. I think Symbiotica makes the best one on the market. They also have this amazing magnesium L-threonate. This is going to help you focus. It's going to reduce brain fog. It's going to balance your mood, help support stress management. If I want a little bit more energy, I'm taking their vitamin B, which is this methylated B formula. They have so many products. And again, this is done by a company that is mission driven with great people. Taking Symbiotica supplements is one of the easiest ways I've found to stay consistent with my health goals, even during a busy summer and fall. All you have to do is go to symbiotica.com/TSC today to get 20% off plus free shipping. That's CYMBIOTIKA.com/TSC to get 20% off plus free shipping.
As a Kendra Scott partner, I am sharing with you how I make this holiday season special. Kendra Scott, you guys have seen it everywhere. It's the destination for holiday gifting with presents for everyone on your list. I just got myself the cutest little cross necklace. I'm wearing it now. You can see it in my stories from Kendra Scott. And it's such a good one to gift for the holidays. If you're looking for a beautiful accent for every day, this is a good place to start. The Kendra Scott holiday collection is full of beautiful pieces across fashion, demi-fine, and fine jewelry that are ready to shop. And you can design your very own custom jewelry piece through their color bar, both in-store and online. So yes, I'll be wearing my cross necklace throughout the holidays. I feel like it's even cute for New Year's. It's just a really pretty piece that I know I'll always have. Kendra Scott is warm, inviting, and friendly. I actually read Kendra Scott's book and I got to see all the behind the scenes of the making of her company. And you can really tell she's so passionate about designing beautiful jewelry. Really, guys, if you're looking for a gift for every jewelry lover on your list, including yourself, you have to check out Kendra Scott. you make the season special. Visit kendrascott.com/gifts to start shopping. That's kendrascott.com/gifts. How do you, Heather, see this out in the wild? Because you're with what you do, you've got like, I feel like my dentist told me, he's like, everyone's on it.
Everyone.
Yeah, everyone.
So everyone is on it, and like that's like a celebrity, or like all these famous people are on it.
Yes. And I have a girlfriend who I've been friends with for 100 years, and she called me a couple of years ago and she was like, I'm so sick of reading about all these girls on Ozempic. And I was like, listen, you've been trying your entire life to get down 40 pounds. You know, there is now help. Go do it. And she did it, and she looks phenomenal. And I feel like what upsets me is this stigma that everyone has against it. When I was in high school, I smoked cigarettes and drank Diet Coke and took Dexatrim. Are you telling me that that is better than doing tirzepatide? It's not. It was dangerous, and it was so bad for you.
This is not dangerous.
This isn't dangerous.
What about the gallbladder stuff that I hear?
Yeah, no.
Okay.
Doesn't really happen.
What about the
pancreatitis is what you heard.
Okay, maybe pancreatitis.
Yeah, no, turns out not so much. The only thing you don't want, if you have a family history of multiple endocrine neoplasia, it's a particular weird, super rare type of thyroid cancer. Okay, you don't want to be on that theoretically. But that study was only true in rats. You can probably, even if you have a family history of this medullary carcinoma of the thyroid, if you have family history, you're not supposed to take it.
And what about the blindness?
Yeah, that is
Have you seen this on Instagram?
a lot of BS, by the way.
By the way, I have actual no opinion on it, and I'm not judgmental of anything. I just am asking you all these questions because I feel like you know them all, and this is all what people say.
But it's scary because I'll scroll through Instagram or TikTok
It is
sometimes,
scary.
and all of a sudden it's like stuff like that. Like I saw a thing on an antibiotic the other day, and they were saying, you know, you could lose your limbs if you use this antibiotic, and I sent it to them. I'm like, is that true?
Okay, do you know how dangerous, how incredibly dangerous and life-threatening Tylenol is in this? Forget about the Tylenol autism thing that's going on right now.
Yeah, but Tylenol legitimately is the
most dangerous drug that you could possibly take.
That's why when these people started chugging Tylenol, I'm like, that is insane. You're going to die. You're going to die.
Yeah. Okay. So if you look at the number of cases of Tylenol-induced liver failure in this country versus how many cases of blindness from these GLP-1s, I don't even know if that's true. But everyone loves to hate on a new thing, particularly when it comes to you took a shortcut to losing weight.
I hate that. I hate that stigma. I don't like that at all. Like I said, what we did was so much more dangerous than this, which is a totally safe thing. What I'm hoping for is that the next iteration of these drugs, and I know they're coming out with a pill right now. I don't know if the efficacy is the same, but I'm hoping for someone like me, I want the ancillary benefits. I want the cognitive health and the cardioprotective and all these
ask you guys
amazing things that are, I mean, every day they're coming out. And now we found out your hair is thicker. You know, it's like every day there's I'm lying about that. But,
I'm like,
every day that there's like a new thing about these drugs, and I want in.
What are those? Because, okay, so I have not struggled with my weight personally,
Right.
And when I hear these things, I have no judgment. Again, like, do what you want. But when someone like me hears, I'm like, well, I don't feel like I need. Like, I could always look a little better, but I don't feel like I need to trim off a bunch of weight.
What if someone doesn't need to
trim
off weight?
What are the other benefits that I could potentially exhibit? And if I'm not trying to lose weight, will it like turn off my hunger hormones and then I will lose too much weight?
So not if you. First of all, you got to figure out what kind of responder you are.
Mm-hmm.
Maybe 30% of people don't respond at all. Maybe I'm in the category where I'm a super responder. But if you're a typical person, you'll go on 2.5 and you'll get used to it. You won't want to eat, and then it'll wear off much more quickly on your body. But the benefits for the brain, and it's about to get indications for Alzheimer's, for addiction disorders. It's
for the heart, cardioprotective.
So it's really all about controlling the sugar and inflammation. So it's going to be the ultimate anti-aging drug.
Mm-hmm.
So that's why you got so into it. It's all those things.
Well, I got into it because I got in a fight with Jillian Michaels in social media. I don't know if you know about this.
Is that still going on?
Wait, tell us about the fight. No,
it was brief. And
Tell the
this
story,
is so
honey. Yeah, tell
my
us the
husband.
story.
So yeah, they got into a little argument because he was talking about the GLP-1s and how much she liked them.
And she talked about how dangerous it was. I'm thinking, what are you talking about? What do you know about
and
them?
he may have made an obnoxious comment like, when I want medical advice, I'm not going to go to a trainer. And then
And if you want to give medical advice, you should probably take the MCATs, go to medical school.
So
she got mad.
It was kind of like that. And then she wanted to like meet up and have a big talk and all the things. And so he didn't do that. But in typical Terry Dubrow fashion, he was like, well, I'm going to become an expert. So he studied for the board exam. He's now a triple board certified doctor, general surgery, plastic surgery, and the obesity medicine now.
You know what I think you should do, and it would go viral? I think you guys should invite her on your podcast.
She wanted me to go on her podcast.
But we get along with her very well, and we know her. And I think what I like about her is she won't be straight up, but she will create the space for the debate.
I think she'll take it like a
She
like
won't.
good.
Well, I was obnoxious, and I apologize for that. That was, insulting. But TMZ, I was coming out of Craig's.
She's got
and
that
had a
skill.
couple drinks on
Hammered.
board, and the TMZ thing here. They go, "What do you think of Jillian Michaels saying it's the worst drug of all time?" I go, "It's like a cure for the number one risk factor of death. So it's the greatest drug of all time." And then I thought, I'm a plastic surgeon. She could criticize me, say, "Well, you're only a plastic surgeon." I thought, all right, so I'm going to become a true expert, and that's why I did this.
That's why he did it.
That's cool though that he gets so curious that he becomes an expert.
By the
You
way,
could call it curious. I'm going to tell you, he's stubborn and needs to be right.
You really need to be right.
Yes, Joe, you try arguing with him.
well, it was scary because I thought, I'm going to become board certified. And then I started reading stuff. I go, this is not my specialty. This is an internal medicine specialty. So here I'm reading endocrinology and nutrition, all these things. And I told everybody I'm taking the exam. And I thought this was so dumb. And then
He's like, why did I tell everyone I was doing that?
Oh, because if it didn't
if
go
I
well.
failed,
Right.
because people
Right.
were going, hey, I didn't find out for 3 months after I took the exam. People were going, hey, how'd the board certification exam go? I'm going, I better pass this. People are.
Well, I think people also they want to ask you questions about that specific thing because people are seeing such good results.
Right. And
Yeah.
it's expanding beyond obesity.
Yeah.
So just so you know how hot this area is, there's a drug. The next one in line is a triple hormone drug. So there's GLP-1, that's Ozempic, GLP-1, GIP, that's tirzepatide. We'll go Zepbound and Mounjaro. And there's a new one called retatrutide, which is 3 hormones, okay? People are so into these that they're now making it illegally, compounding it at a pharmacy, and it hasn't even been FDA approved
right, yeah.
now. They call it Reta. It's all over the internet.
Is that one good or bad?
It's if you look at the data right now in stage 3 clinical trials, it's way better with way
But
less
better
side effects.
how?
I'll tell you how. So one of the ways in which you sort of evaluate these, what % of your weight will you lose in the study period of time? So Ozempic, Wegovy, is like 10 to 13%.
Okay.
That's pretty good.
Yeah.
So if you weigh 200 pounds, you'll lose 20. That's not bad, maybe 22. Tirzepatide is like 18%. Okay, way better. Retatrutide is like 25%.
Wow.
With less side effects.
What's going on though? This is what scares me about this. What's going on with the skin that's sagging from losing weight so quick?
Exactly. Or
But
the hair loss.
Yeah.
Well, skin, I mean, I don't care how you lose your weight. You lose weight, it happens in your face first.
Yes.
Always.
I think if I were to lose weight quicker with
Yes.
the help of one of these,
You're right.
from the people that I've interviewed, I would take a massive amount of amino acid.
Eat a massive amount of protein.
Massive amount. I already take so much amino acid because it's literally changed my entire hair. Like, I cannot say that enough to everyone who's listening. But if you are on it, to me, to balance it out with the hair loss and the weight loss, you need protein and amino acid, right?
Right.
No question. You're exactly. I would recommend a collagen too,
A collagen too.
multi-source collagen peptide.
So you almost have to it's like a what's it called? A seesaw.
It's a balance.
Yeah.
Yeah. Well, it's because of the rapidity which you lose weight. You just lose it so quickly. Look, if you starve yourself, if you fast for 30 days, you're going to look the same. It's the Ozempic face phenomenon.
Yeah.
You've heard of the Ozempic vulva
Sure.
phenomenon?
No. Well, tell us
I
about
have
the
not
vulva.
heard about the
Terry
vulva.
Dubrow, let's get some social clips here. Tell us about the Ozempic vulva.
So
Is that how you say it?
Ozempic vulva is a real thing.
Just for the record, I do not have Ozempic
That's what I'm going to
vulva.
open the episode with. It's going to just be you.
I didn't like that. I figured like
She can open the episode saying, hi,
Hi, I'm Heather Dubrow. I do not have Ozempic vulva. My vulva is just
your vulva's nice, I must say.
Thank you.
So, Ozempic vulva is not that you've lost so much weight down there. Things are loose, like with Ozempic face.
I like how
Like
you,
the
thank
hands.
you
Sorry
for the,
about
thank you for the
that.
visual as well.
Yeah, maybe that wasn't good. But Ozempic vulva refers to this concept of decreased hydration and lubrication down there. So it's not as moist and lubricated. And because, the difference between us and them is that our stuff is skin covered.
Mhm.
Their stuff is mucosal covered. So it's like the inside of the mouth. So you really need moisture.
We are
for
really
this.
getting to know each other here today.
Do you
I
know what
didn't
I'm
have this on
saying?
my
I
bingo
know
card today.
exactly what you're saying. It makes a lot of sense.
If this
Love
is
the
a,
visual.
Well, have
this
you
is a
ever
li-
heard that people that are on these GLP-1s get dry mouth?
you get dry down.
So it's dry everywhere.
So you get like vulvitis and vaginitis and all of these things.
I thought you were going to say like you just like there's the weight loss causes like a puffy pussy or like something.
No,
a
it's the
deflated.
opposite.
You'd be
It's the opposite
deflated,
one.
right?
Remember we were talking about
Because
Ozempic face.
So
Same
it's a
thing.
deflated
It's a-
vagina.
It is.
Deflated and apparently dry.
So it's like a
Not
balloon
cute.
deflated.
It's dry.
So
And
now
like,
people are going to be going to get filler in their vagina.
no, you have to hydrate, and it's really important to stay hydrated because when you lose when the satiety centers of your brain, you're not hungry. You're also not drinking as much. People drink, and you just lose all sort of interest in food and liquid when you're on these drugs.
So it sounds like if you're on these things, you have to really be proactive
You do.
in your diet and taking
Right.
your protein and your
Yes.
collagen and your aminos
And
all-
lifting
and-
weights,
And
like we
lifting
talked,
weights.
but it's even more important.
Okay. And what about, I heard that a lot of people who are experiencing, you mentioned this earlier, someone who drinks a lot or does drugs or it's turning that center off. Is that
It's
right?
fantastic for that.
Yeah, because you literally can't drink
It
when you're
should-
on these drugs.
I think it should have an FDA approval for alcoholism. If you're an alcoholic, because you drink on these, and by the way, I did, when I first started doing it, I'm on 2.5 now, and I do it every 7 days, every 10 days. I sort of do it in a designer way. If I'm going to go on vacation, I'll go off it so I can overeat
so he
and
can
overdrink.
Yeah.
Oh, that's fine.
Yeah, I
If
know,
we're going
right?
away next week, there'll be no dose.
Yes.
We'll be on
Sunday
the
night-
beach drinking,
Sunday night I
eating
won't do it.
chips. Yeah.
But the first time I went on 5 milligrams, I had 2 margaritas the next night. And anybody's listening to this, if you drink too much, or even drink your normal too much amount, like if you're on vacation or going to a party
Get
or
very
something,
sick.
you'll be sicker than you've ever
sick, like
been.
vomit sick.
Vomiting doesn't even give you relief. It's just sicker than you've ever been
Oh.
in your life if you drink alcohol on these GLP-1 drugs.
So if you're an
I've seen
alcoholic, it
people
would,
that are drinking on them.
You can drink a little bit. Look, once you
I feel like so many people I know that I've like had a drink with are like, oh, I'm on it, and they're
Yeah.
drinking.
Well, also the effects. and
Maybe
side eff-
it's different person to person.
well,
too,
the
isn't
effects
it?
and side effects will wear off. So even if you have the sort
Hmm.
of indigestion, the GERD, the all of this sort of delay emptying issues you get with these drugs, they wear off the longer you're on them.
Huh.
These
God,
are the
I've
be-
learned so. It's like been like a master's class.
This is the biggest breakthrough in the history of medicine.
Let's start the episode off with that. Now let's talk about the biggest breakthrough of beauty. And I'm going to ask you this.
Okay.
What are you seeing in the beauty industry that is rocking your world?
I mean, I have to say, I think that, so we have our own skincare and supplement line that we've had for over a decade. And our whole concept was an internal, external approach to health, wellness, and beauty. So it's called Consult Beauty. Terry does it on TikTok Live right now. If you need a laugh for an hour, you can check him out.
I just make jokes for 2 hours.
He's very silly. Anyway, but that was our whole vibe. And I have to say, I think everyone else has finally caught up to this. But, ingestible collagens and peptides and all of these things that we're ingesting, I think absolutely come out in our skin. And I think the topicals have become so much better too. I mean, back in the day, it used to just be vitamin A, C, and E.
Yeah.
And that's all we had.
What do you think about peptides, not the GLP-1s, just regular peptides?
Injectable peptides?
Yeah.
I haven't done them yet. We're going to test it.
Yeah, we're about
It's
to do an experiment on
it's a
ourselves
little-
with the 2 most common types.
Yeah,
which
'cause-
one? The BPC?
Yes.
I've done
and
it
the
straight.
Simorlin.
Yep, great.
Yep.
I
it's
think
a
you'll like
little-
the peptides.
Yeah, but what are they doing to you
Right, because everyone
physiologically?
we've spoken to, it's like, I love them. They're great. Well, how do you feel differently? I don't know. I just feel great. I want a clear reason why
did
I'm
one-
taking something.
I agree with you.
I did
agree with you.
one. I can't remember the exact name. I could find out, and it was a sleep one actually,
Yeah,
and it didn't make me sleep longer, but it gave me like a healthier, deeper sleep,
better
and
quality.
and I was on fire after that. Like I felt
Really?
great.
Did you
And
go
I-
off
should
it?
try that.
Yeah, I mean, I whenever I do it, I'll do it for like a week or two. And then
cycle it.
I cycle it. Yeah.
Yeah.
And then I go off, and then I cycle for like a quarter. I don't go back on for a while.
And do you feel like you maintain those results after being on it?
Yeah,
So it
and-
like retrains your body a little bit?
Yeah, and I hurt my back real bad. That's the BP, and I did that, and that took me like 90% of the way healed and faster.
So here's the
Interesting.
problem with this. These peptides are not FDA approved.
Mhm.
They're not regulated. You don't know where they're coming from.
Yeah.
You got to get a trusted place. Yeah.
You know, and they're completely untested. They're not any different really than doing steroids at the gym. You know, trend, you know, they do trend. That's actually better, more studied trend, because more guys have done it and can tell you the dose of trend to get shredded is this. No one really knows the right dose. You go to one Beverly Hills doctor to get these peptides, he's going to put you on this for this dose. And then the guy down the street goes, nah, I do this, and they're all making it up.
And
And
that
most of
doesn't
it-
mean it doesn't work.
And by the way,
but it's
most of it,
scary.
truthfully, is probably placebo.
Well, and
Ah.
that's interesting too, because at least with my back, I was real messed up. And so that's why I did it. And it was to the point where this injury where I was like, oh, I'm not going to be walking right for a while. And so
Feel
even
sorry
if it
for
was
me.
placebo and it
so
worked,
annoying.
I
I'm
You're
do.
in.
Yeah, I'm
Oh,
in.
I couldn't
Right?
hear
I don't
about
blame
it.
you.
My heart breaks.
Yeah, I didn't care. I didn't care.
So bad. And I was 9 months pregnant. And he's like, my back hurts. I'm like,
No, but
Oh
you know
my
when you
God.
throw out your back, it's a real thing.
You-
But you know what?
Listen,
You're-
when I was 9 months pregnant with the twins, I had kidney stones, and
Ugh.
I was lying on the bathroom floor, 9 months pregnant
We have to tell
with
the story.
twins, with my head on the cool tile, passing kidney stones, and he stepped over me.
I went, can I go to the bathroom? I wasn't as
Oh, was he
sympathetic as I
supposed to-
might be.
Oh,
But here's the thing.
So I feel for the back.
No, but here's the thing. You say, even if it's placebo,
Even
you're
if it
okay
was
with
placebo,
it. But
I was
what
fine
if
with it.
we find out that with prolonged use of it, it exposes you to a greater chance of cancer?
No, or that's a concern that people are talking about and having. Yeah, I mean, honestly, at the time, I would have gotten that back pain was pretty bad.
You would have
Yeah,
done
you would've
anything.
done it anyway.
But the thing with the
Yeah, I don't-
GLP-1s is they've been around for so many years
Mhm.
because diabetics have used them that they
We
have
have 14 years of data for
yeah,
the
that there's a lot of
GLP-1s.
data. This peptide thing is concerning because you really don't know what the long-term effects are.
Yeah, the ones that can grow things like the growth hormone ones, you got to.
Yeah.
I think those are the ones you got to be just thoughtful about. Again, I'm not the expert. People,
Right.
the people in the peptide space, and we've had them on the show, are going to watch this and be screaming. I mean, I'm just saying I've tried them, and those are my
But
experiences.
I'll tell you something, the people in the peptide space who come here with the MD, FACS certified, we're making it up. We don't know. We don't have data. It's not taught in med school. It's not residency. We're just like flying by
So
the seat
that's
of
the
our
other
pants.
thing we get a lot of shit for doing this show, because we've been skeptical about medical advice in general. Just like, not that we don't think there's great doctors and there's a place, but when I hear things like that from somebody who practices the way you do, like I imagine there's a lot of people in medicine that are also kind of just winging it in some areas. And we've seen now, like you really have to be your own kind of
Well,
advocate.
I also think personally that, being a doctor is tough these days.
Oh, yeah.
The, insurance return, what doctors get paid and all of that. And it feels like people want to try to enhance their salaries.
You know what?
And so they sell that's why you see dentists doing facelifts and, OBGYNs doing liposuction and all this crazy stuff that really never used to happen. So now doctors are selling youth. We're selling peptides. We're selling, all this stuff. That's scary to me.
That's a great point. But I'm glad, by the way, I'm kind of glad because what doctors did when like OBGYNs that weren't making any money from the insurance company anymore because the reimbursements were so low, they would start doing, let's do liposuction. Oh, I'll take a weekend course in breast augmentation.
Yeah.
Let's start doing facelifts.
Because you have a medical
I would rather,
license, you can do anything.
I'd rather
Oh my God,
them
that's so scary.
prescribe peptides
Than
than
that.
put a scalpel in their hand and do
Yes.
cosmetic surgery.
Does liposuction really work?
Yes, if it's done in a very particular way under the right circumstances.
Which is what?
So you have to have relatively tight skin.
Okay.
If you have loose skin, it's going to make it worse. If you have a lot of cellulite, it's going to make it worse. So skin laxity, critical, and you have to have very focal area of what's called lipodystrophy of fat. So let's say you have an area out here, and the best liposuction candidate would be a dolphin. Because you suction the fat, and the skin is so tight, it's going to just wrap right around the new area.
But also, isn't it true that liposuction is actually better on thinner people? It's not to reduce someone who's larger. It's really for someone who has like a spot-resistant area, someone that's got the tire or the outer thighs or things like that, if the skin's tight.
If the skin's good.
That's the perfect candidate.
If you don't do it too aggressively.
I would die if you brought a dolphin on Botched and you did liposuction on a dolphin.
Well, it would have to be
I
a
think the
botched dolphin.
Humane Society
No, it'd have to be a
might
botched
differ.
dolphin. That's the only way you go. Now to get on Botched.
Maybe if his little fin is
So this guy texted me, I know from CNBC. Okay, I'm a fan of him on CNN. And he says, a friend of mine, his wife has got a disaster problem. And he sends it to me, and it's kind of not, it's bad, but it's not bad enough to get unbotched anymore. To get unbotched, you have to be destroyed now.
Yeah.
After 10 years unbotched, it has to be really bad.
Like, what's the worst thing you guys have ever seen?
Unbotched?
Yeah.
probably
So
wrong.
we had this lady in season 3 that went to one of those plumping parties. You ever heard of these illegal plumping parties?
What's that?
You ever heard someone say, "Oh, I've got a girl, and we all go to this house"?
Yeah,
and we-"
yeah, like a Tupperware party.
yeah,
Right, and have
like
silicone or whatever. And it turned out she was doing that, turned out to be caulking material from a
Like
hardware
cement.
store,
No
like
way.
cement,
Like actual caulking?
like
for
actual
constru-
caulking.
Mhm.
And people have gone to prison for this.
Holy
The
shit.
madam in Florida. So she had all this stuff. Initially, it looked good, and then the immune system started to overreact, and she came in with these masses all over her
It
face.
looked like boulders,
And
in
no
her
doctor
face.
would touch her because they were concerned that if you take it all out, you're going to kill the blood supply to the skin. That's going to die, or the nerves are going to end up looking like a stroke, or the immune system is going to go, yes, screw you, and make it worse. So we turned it down season 3 like everybody else did. Season 4, I brought her back, and I took an orthopedic saw and sawed the concrete out.
Oh my
I
God.
left the upper, a little bit in the upper, a little bit of the lower, and you could kind of feel it, but you feel your bones feel like concrete.
She
and
looked
she looked
so good.
totally normal. That was my biggest success, success on Botched.
With what you do with that must be so satisfying.
It's
Like fulfilling.
it's the best thing that ever happened to
Yeah.
me. And
Oh,
it,
yeah.
it taught
Cool.
me, you get good at what you do all the time. So I became very good at doing impossible surgery. But by the same token, you're taking on cases that if they go badly, everybody's going to go, that wasn't fixable. What were you doing? Human experimentation? You shouldn't have even tried that. Now, though, the impossible is quite normal for us to try, just as long as we apply regular surgical principles. So it's been super rewarding.
Really cool. I want to take a turn. This is like such a turn and talk about real estate.
Yes.
What you guys have done with real estate is so inspiring
Yeah.
to me. I don't know a lot about it. I would love to know how you guys got into it, how you think about it, when you know to buy, when you know to sell.
Yeah.
I think it's fascinating.
We are accidental flippers.
Huh.
We never meant to be.
We're pretty good at it.
Yeah, we're experts
We
at it.
never sat down and went, we should buy this house and flip it. Like that really has never been a conversation. Weirdly, we move every 3 years. Like my twins, I think they've lived in 11 or 12 houses.
Just for variety to switch
no,
it up.
just
or?
because it's how it happened. You know, we got this house. We were living in Bel Air. We had the twins. We bought this second place down in Newport so we wouldn't have to commute. And then the market went crazy. So I threw the house on the market, crazy number, and it sold full price, 10 days. They turned out to be criminals. I have no idea how that deal went through, but it did.
It did.
But
So
that-
you just do that and you're like, if it happens, great. But if not, we're happy in the house.
No, other houses, we had knocks on the door.
Wow.
Honestly, the 2 we built from the ground up, they were knocks on the door.
So they're knocking at your door saying, can we buy your
Not
Well,
literally.
Josh
but
Altman
like
knocked.
the
It's
last,
called bird dogging, Lauren.
yeah, the last one, Josh Altman, we're good friends now, but I didn't know him at the time. And he was calling me and blowing up my social media, calling my podcast studio. And I go, who is this guy? Why is he blowing up? I go, Terry, you call him. And he goes, oh, there's a guy that wants to see your house. And I went, Oh, okay. And this is the only place we lived in for 6 years because of the pandemic. This is what's commonly known as Chateau Dubrow.
Okay, I was going to ask you about the
so
iconic one.
That one. So it was that one. And I designed every square inch of this house. Every
Beautiful.
ceiling detail, every
Amazing.
edge detail, the furniture, everything.
So cool.
And and even though it had been on the show, no one really knew the house because we had secret rooms and we had a panic room and things that weren't shown. So I said to Josh, I'm like, yeah, okay, come over. I'll show the house. I didn't take it seriously. I went for a run. I was like sweaty, I had a baseball hat on, and Josh comes in with this gazillionaire and his entourage. And I gave him a tour like I would give it to you. Like we were in my bathroom and I had drawers that warmed my towels.
I already know all about it.
And I was like,
I was zooming in when I saw that. I'm like, oh my God, she's so good at the details.
Yeah.
That was
I love
cool.
details.
Is this the one with the mirrors and the and like the
Yeah,
your
I
vanity that opened
screenshotted
up,
your
like, the
mirrors
light
that
and the
open up
thing?
your
Yes.
vanity.
Oh yeah, they opened that one.
Yeah.
I
That's
forgot
right.
about
Yeah,
that.
see, I've even seen this.
So go ahead.
But like I would stay up at night and think when I was designing it, I was like, oh wait, the door to the shower has to open to the left because the door to the warming drawer opens this, like all where the dumbwaiter was, like all these things. And then of course I had my ring for champagne in my closet,
So good.
which rang in the kitchen. But the design flaw was, I don't know who was bringing me the champagne in the kitchen.
Well, I feel like you need to hire like a Jeeves.
Yeah, probably.
We've talked about that.
We have.
You need a
Yes.
Jeeves. Like, you know how Patricia
Is that an
had
Ask Jeeves
Michael?
reference? Like the old search?
Boy, that's-
Yeah, wow. We're
Yeah, like
dating
a-
ourselves
like you
here.
need
Like,
like-
do you still have
Yeah.
AOL?
By the way, you just got off of AOL like 6 months ago.
No, I
Like,
still use it. I still use it.
seriously, the last person using AOL. But anyway, so I gave him this like amazing tour and I really didn't think anything of it. And the next day he made us an offer. We countered once, made a deal, third highest sale in Orange County history, and we had to be out in 3 weeks.
I have a question. This is another tangent question. When you're in Orange County, and I've watched the show forever, and you sell your house and you've worked so hard on every detail and it's such an incredible house, and you like have to tell your friends in Orange County this, are they like excited for you, or is there like there's got to be weird energy with this. They've got to be
Well,
like,
it was on the show. I mean, there was definitely weird energy
Very weird
surrounding it.
so there's like because I think that what I see as a viewer is like you guys have gone to the moon, and then there's maybe people that are like want to go to the moon or pretending they're on the moon and they aren't, but you guys like are on the moon. So there's like a jealousy situation going on.
Right, but isn't that so sad? I mean,
Yeah.
with my friends that I know are my real friends, on and off the show, they're happy for me.
It's incredible.
And
They should be
us.
inspired.
And I am so happy for them. Like I want everyone to be successful, you know, and I would hope that someone would look at that and be like, because this is how I look at people that I aspire to be. I think, wow, if they can do that, I can do that too. I might have a different road, but I can do it too.
Yeah, but for those of you who live in Schadenfreude, our next project we lost 6 million
failed.
on.
You know what though? But here's again, as a viewer, when you guys came out and said that, I like that you guys are showing that because it shows like that life is about ebbing and
Yeah.
flowing, and
Yeah,
there's bumps
can't
and
win
there's
them
this,
all.
and this is reality. And you guys had a major accomplishment in Orange County,
Yeah.
like to be the third. That you said the third
Highest sale.
highest sale. That's insane. And then you show this part.
Yep.
I like it. It shows like
Thank you. Yeah.
it shows ebbs and flows.
We've done, I mean, honestly, out of all the homes that we've built, renovated, bought and sold, we are very net positive. But there were, one or two clunkers. You
Two.
can't win them all.
2 out
I
of
think
8.
there's like such a
That's
message
still good.
in there.
That's good.
I'm
Yeah.
gonna just guess though, if I'm putting money down, that the next one's gonna be like, there's gonna be something crazy in the next one.
No, it's funny. We are now living, so we bought this penthouse a couple of years before.
Do you like that after living in houses? I was actually curious
I'm
about that.
obsessed. I
Huh.
never want to see a blade of grass again.
Why?
Because I've had grass. It's lovely. Someone else can have it now.
It's a lot to maintain.
It's a lot to
Yeah,
maintain.
it's a lot of work.
And as much as I loved that last home, it was 22,000 square feet, and I was the manager of that hotel.
That's a big, that's a big
And it was a
property.
lot. And I don't want to sound ungrateful. The house was gorgeous. We had a wonderful time
So
there
much work.
and made so many memories. But like, and I was always really careful with Terry because he would be at work all day and I would be doing my thing, whatever, with the kids. But when he came home, I made sure there was no staff there.
Yes, because it almost makes it like seamless and relaxing for him to get off
It was
work.
awesome.
and
So
not-
it was private, but I was with people all day long. So I really never felt alone.
That is so interesting. So it felt like you were working at a hotel as managing the
I was
property.
I just felt on all day. Not every day, but most days. And the people that work with us are fabulous and I love them. And they've worked with us for 10 years, 15
But
years,
it's your
all the things.
home.
But still,
Yeah.
sometimes you want to be grumpy
Yeah.
and you want to go downstairs, not pulled together or whatever it is, And so that was a little bit difficult.
Yeah, I mean,
Also,
listen,
people are bringing all their different energies and their stuff into your house without them even knowing it.
she tried to have, even just, and this is not the same example, but she tried to have her sister stay with us this time in the hotel. I'm like, listen, no. And
She-
I'm like, because I need to be sometime, you don't want
You said you want to walk around
I
with
want
your
to be
balls
walking
out.
around. I don't want to be wondering, what they're going to see me in,
No,
what kind of
it's-
condition.
But
That's
you know
totally
what?
true.
Interesting.
But this penthouse thing, all right, so we
Yeah, tell
bought-
us about the penthouse.
Oh,
Okay,
yeah.
so this is what happened. So it was sort of a lark. We were like, oh, we're going to find a little pied-à-terre in LA. It'll be our place for someday. We'll stay there now and then it'll be for someday. So we started looking around. I went to every building in Los Angeles and I like real estate and I wanted to see all the buildings. And we hadn't lived here in a really long time. So we saw every building and then we found this apartment and it was like, the gates opened and the
Yeah,
angels were singing. It was so beautiful
you got to
and
see it.
perfect. But it's only a 2-bedroom apartment. It's big, but it's only 2 bedrooms. And the view is just spectacular. It's like from the Hollywood sign all the way to the full ocean and it's amazing. And we're high and it's like being in New York, but on the West Coast and it's so cool. And there's 10 people downstairs that can help you at
what
any
area of the
time.
city is it in?
Century City.
Okay. That place that's coming up over there.
It's
We were just looking at office space over
Yeah,
there.
it's so great. So we bought this place and 10 days into escrow of buying it, that's when Josh Altman started blowing up my phone for the house. Now, would we have bought that penthouse
No,
if we knew we were selling the house? Probably not.
no.
So now we have this 2-bedroom and we have 4 kids. 3 are in college, 1's in high school. So now what we're doing is so stupid. We rented another apartment in the building and we go up and down on the elevator.
Hold on. I have 100 questions.
Okay, so
Yeah.
you stay
Wait,
in the
you-
main one,
you
and then your
guys-
kids
I
can
would,
stay.
I would love to tell you that we live upstairs and they live downstairs, but I have a 14-year-old. So we actually
Oh.
sleep in the rental downstairs, and 3 of the kids have bedrooms down
Okay.
there, and the dogs live in that apartment
In the
with
rental.
us in the rental.
Okay.
And then I don't even have clothes down there.
Who's in the penthouse with the 2 bedrooms?
So our oldest son lives in LA because he goes to school here. So he has the 2nd bedroom upstairs because he's really not there. So I could still use it as a guest room if I need to. And then our bedroom, no one's sleeping there, but it's my closet and my bathroom. I don't even shower downstairs.
So you guys are going up and down?
Yes.
Yes.
There's no way the building can connect them. They're not right on top of each other.
No.
She's
but
fine.
funny that you asked
Buy
that.
the
I'm
one
trying to
below
buy
us.
the apartment underneath us.
Dude.
So you would
Then
just
you can
knock
connect
it
them all.
and just do a stair
I would
situation?
probably put just a spiral stair, but honestly, it's like having a private elevator because we're at the top of our stack, so you can't. The other couple of floors above us go to the other elevator stack, if that makes sense. So in our elevator, we're the top floor,
Okay. Okay.
so no one can. And the elevator doors open into your apartment.
And you don't miss having a home. You like this is like the chapter that you want to do now.
So for the first 3 months, I so missed the old house.
He did.
Because, you're saying you didn't want relatives in there so you can walk around and do your thing. I remember my kids had 15 friends
You
over.
didn't notice.
Couldn't hear them.
Yeah.
The house was so big.
Yeah.
So it was so giant.
But then did she explain the behind the scenes that the Wizard of Oz was making it all
I knew about it.
like perfect?
I
so
knew
you
about it.
you come home, there's no one there. She's been with people all day long. She wants to blow her head off because there's been a million different people and energies and all these people.
Totally. So I knew
I
about
could
it.
see why she likes the penthouse.
I
Yeah.
mean, I stopped singing because of that house because there was no.
you can't
Our piano
price-
was like in the middle of the entryway, and it was like there was always people.
But
and then you started to like the penthouse.
now I'm obsessed. You pull up, it's one of the nicest buildings in LA. You know this building, the white one.
I know what you're talking about.
Yeah, you know it. And there's doormen. There's like 10 people.
And everyone's so nice.
And
And
there's-
there's amenities.
And you
There's
don't
a-
have to worry about safety.
at all.
And there's a
Yep.
party room downstairs, and there's a screening room, and there's a dog run, and there's a gorgeous pool, and we have a cabana at the pool. It's like living in a hotel, but you have your own space. The only problem for me, honestly, was that we bought the apartment furnished. And because we were a little bit transient after we sold the house, we were in some rentals in Orange County, and then we were doing that house that failed that we decided not to build. And I hated the fact that I felt like nothing was mine. So I finally I redesigned the great room in this apartment. And it took a year to do it. And I just finished it. And he's going crazy because
She won't let me go in there.
I won't let
Might
him
as well
sit in
put
it.
plastic on the
I
couch.
totally get that. I literally understand that from my bones. I wouldn't let him go in my office until it was all done.
I know it's done. I won't let him go, Lauren.
Why won't you let him go in it when it's
Because
done?
I'm telling you
Because
why.
I'm dirty or something.
No.
You don't want to be
Listen, in the Crystal Cove house, that big house that we sold, everyone was allowed everywhere. There was no precious rooms. It was 22,000 feet. We used every square inch of that house. Dogs everywhere, kids everywhere. Nothing was off limits. I think because this is the first room, since that house that feels like me.
Uh-oh.
I love it so much. I almost like want to put up ropes and just be like, let's just walk by it.
You should put up ropes around it and not let anyone in but you.
It's funny.
This reminds me a little. My mother used to
do.
do stuff like this. There was like one area in the house that we were not allowed to go in
I
as
know,
children.
but
Dining
I've
room.
never been like this
Ours
ever.
it was next to the dining room.
Or
It was-
living room.
I
Yeah, it was
love
like-
that for you. I think that you should have that. I
It's
also
so
don't you
beautiful.
like unveiling it though? I like to be like, look what I did.
Oh, I let people see it.
Yeah,
they
they
just
can see it.
can't
We only got to
sit.
go in during Christmas. That was like Christmas was celebrated in
I
this room.
do hate when people sit on my white couch at my house.
Well, Lauren had the bright idea with this, when we're moving, but this one we were in to have 3 children under 5 and then get all like white furniture.
Yes, good plan.
Oh, yeah.
You know
Ugh.
what? It hasn't been that bad, Michael. It hasn't been that
It
bad.
hasn't been.
It hasn't been that good.
I don't know. For some reason, I didn't care before, even though that house was like very expensive and all the things. Everyone touched it. Was fine. And I know this will be fine too. I'm enjoying looking at it so much. I don't want anything touched.
Quick break to talk about Wayfair. If there's one thing that I personally love and that I talk about all the time, it is efficiency, which is why Wayfair is such an incredible partner for us in this show and for you as well. Wayfair is the place to shop for all things home, everything from sofas to spatulas, you name it, they have it, and you can get up to 70% off during Wayfair's Black Friday sale, which is coming up. That is a massive discount. Wayfair also has styles you can't find anywhere else, no generic pieces you've seen hundreds of times, so you can make your home way more you. What I love about this is Wayfair is the go-to destination for everything home, no matter your style or budget, and you can earn and get the best savings in the neighborhood with Wayfair's new loyalty program, 5% back on every item across Wayfair's brands, free shipping for members-only sales, and more. Their holidays are coming up. If you want to do that holiday decor and make sure you're ready for hosting, they can help you with that. They also have everything you need to furnish your home, whether it's your living room, outdoor areas, bedroom, and like I said, an incredible holiday selection with cookware and homeware. You really can't go wrong if you're in the home and you're trying to dial it up for the holidays, if you're moving into a new place, if you're looking for a gift over the holidays, if you're just trying to update the look and feel of your house, Wayfair has you covered. Starting October 30th, you can shop Wayfair's can't miss Black Friday deals all month long. Plus, you can sit back and relax with Wayfair's fast and easy shipping just in time for the holidays. So check it out. Don't miss out on early Black Friday deals. Head to wayfair.com now to shop Wayfair's Black Friday deals for up to 70% off. That's WAYFAIR.com. Sale ends December 7th.
One thing about me is I am a thank you card person. I love, thoroughly enjoy giving a thank you card. I love to have my own personal stationery. And with that obsession, I also love a holiday card. So enter Minted. Minted has unmatched paper quality and customization options that allow you to up-level your holiday cards. So what we do every year is we shoot a movie poster with our family and we do something like really funny. So we've done Vacation, we've done Scary Movie, I feel like we've done The Usual Suspects. We've done some really great movies and I like my paper quality to be amazing. So that is why I personally love Minted. This is like very me. I want to make a statement when I send a card if I'm going to spend the time on it. And what I like about Minted is you can also add luxurious hand-pressed foil accents, or you can make an impression like I like to do with Minted's letterpress designs. Another plus, Minted has free addressing services, which makes sending cards so seamless and easy. So all I do is I uploaded my contacts and Minted will print each address on your envelopes along with a beautiful, and I'm talking beautiful, coordinating design for free. So they make everything easy. Minted makes everything easier with free recipient addressing, printing all your loved ones' addresses on the envelopes for free. Like I said, a real plus. So stationery or holiday cards, go check them out for high quality and unique pieces. I love their personalized stationery. Bring your traditions to life with independent art and design this holiday season. Use code SKINNY for 20% off minted holiday cards. Use code SKINNY for 20% off minted holiday cards, gifts, and wrapping paper. Again, that's code SKINNY for 20% off your minted holiday cards, gifts, and wrapping paper.
Let's take a quick break to talk about 7 Diamonds. I want to share a brand that's become one of my favorites, 7 Diamonds. They're a modern lifestyle brand that creates clothing that fits seamlessly into everyday life, pieces that look and feel great, comfortable and versatile. Whether you're at work, out to dinner, or just enjoying the weekend, their clothes make it easy to look put together without thinking too much about it. I really connect with what they're doing and love the assortment of items that they bring to the table. I'm a huge flannel guy as we get into the holiday season, as we get into the winter months. I love a good flannel, and it's hard to find one these days. 7 Diamonds makes one called the Montpellier Overshirt, which I have in size large. It's an incredible flannel that's like thick. You can wear it over another shirt. It's versatile. You can wear it out to dinner. You can wear it in the day. It's warm and it looks cool. I think for anyone thinking about getting a gift for their dad, their husband, their boyfriend, their brother, getting a solid flannel for any man is a win, and 7 Diamonds makes an incredible one. It's called the Montpellier, again, for anyone that's looking for it. You can really tell that 7 Diamonds cares about the details, their fabrics, their fit, and the subtle touches that make every piece feel intentional. Like I said about that Montpellier overshirt. And they really highlight the thoughtfulness that goes into each piece. The pieces look refined and polished without being overdone, and it just makes getting dressed all the easier. They have such a wide assortment of clothing. If you don't want the overshirt or the flannel, you can do all sorts of different things. I also have this calfskin over jacket, which is rad, and a bunch of their sweaters and t-shirts. The pieces fit naturally in my day, look great, feel good to wear, and like I said, it's a great gift for the holiday season, whether you're shopping for yourself or for the men in your life. Of course, we have an incredible offer for this holiday season. Use code SKINNY20 for 20% off your first order at 7diamonds.com. Again, that's code SKINNY for 20% off your first order at 7diamonds.com. The 7 is the number. It's not spelled out. 7diamonds.com. Check out the link in the show notes. You won't be disappointed.
This episode is brought to you by The Skinny Confidential. Out of all the products that we have, the one that has changed my life the most, besides mouth taping, is our brow peptide. So how I initially wanted to bring this to life was I was using castor oil on my brows and lashes to grow them. I had read all about how the Egyptians used castor oil back in the day to grow hair. And so I started applying castor oil on my brows and my lashes, and I was blown away. So I wanted to create a Skinny Confidential product that, yes, had castor oil in it, but I wanted it to be organic and cold pressed. So we found the best castor oil, and then I added a peptide to it. So our brow peptides ingredients are really simple. They're straight to the point. And I have to tell you, this product I use twice a day. So I'll do my skincare in the morning before I go to the gym. And then right when I'm done, I'll swipe the brow peptide in it. And it makes your eyebrows look really youthful and young. I brush them up. They look really pretty. It's kind of the final step to my skincare routine. Then I'll put some lip gloss on and I'm ready to go. And then at night, it's also the final step in my skincare routine. So I'll put the brow peptide on, put a little lip mask on, throw on my Skinny Confidential mouth tape, and I am good to sleep. I do this every single day, twice a day. So definitely check it out. You can go to shopskinnyconfidential.com. Grab the brow peptide. You're going to want 2. I have them in every handbag that I have. That's shopskinnyconfidential.com. On Housewives, I feel like you're the voice of reason and the logic. Does everyone tell you that?
Yes.
Because it's like so chaotic. And then you have this person that's like, sometimes you'll like repeat back to them what they said and they like realize the absurdity.
Sometimes.
Well, the audience does.
Yeah.
The audience realizes the absurdity. It's so absurd. The show needs your point of view. What are we going to do without you?
What, am I leaving?
I don't know. Are you?
I don't think so.
For some reason, I thought you said you were leaving.
Nope.
Thank God. Oh, I was going to ask you about that.
I mean, unless there's something I don't know. No.
I thought maybe you were going to move to Beverly Hills on the show.
You know what? Here's the thing. People don't really understand distances. It's like some of the girls live as far as Costa de Casa
Right.
on our show, which is really far. Is that south?
You guys
East,
don't live
something?
next door to each other.
No, it takes just as long to drive from there to
Yeah.
Newport Beach as it does from Century City to Newport
How
Beach.
many of the Real Housewives of Beverly Hills live in Beverly Hills?
None.
That's a riddle.
Maybe one.
I don't know. What
Sutton
do you
lives
think?
Sutton
One.
lives in Bel Air.
Bel Air. None of
Yeah.
them live in Beverly Hills.
None.
Okay.
Some live in Pasadena,
For
right?
some
Look,
reason,
I-
I thought I saw somewhere it
Oh,
was a
say
fake.
that people
Okay,
try
that
to
you
start
said
rumors.
no. That you said that you were leaving. No.
Well,
Thank
people,
No,
God.
and I
No.
started this show when my youngest child was 9 months old, and he's turning 15 in December. So these are my girls. This is my family. You know what I mean? Like when they asked me on the lie detector, of course I had to tell the truth.
What
Where-
did they ask you?
They
for the
asked me
audience?
if you'd rather be Real Housewives of Beverly Hills, and I said yes. And I go, it's a shorter commute. And I'm joking, sort of, but look, it worries me sometimes that there's pieces of my life that you don't get to see because I am not currently living in Orange County. I mean, will we end up getting a beach house down there sometime or what? I don't know. You never know.
We tried to buy 7
Oh,
properties
but
there.
yeah, we did a
I
couple.
also feel like you're one
years
of the
ago.
only husbands that has kind of made it through unscathed. Meaning, like you're
was
Michael,
scathed
Not
Michael-
completely.
once.
I've been scathed.
no, but
a
I
few
mean, like
times,
some
yeah.
of these
Scathed.
guys really go on there, and it doesn't end up well for them.
I've learned to hold my tongue a little bit, but even still, I still get, when I walk on, I go, what are they going to find out about me now that I don't know about?
Yeah, but you are a pro, I think, also because of all the different things you do. You're
Yeah.
a pro on TV, whereas a lot of the husbands maybe don't understand
You know
that.
the world of entertainment.
Yes. Plus,
I'm so happy that you're not going anywhere because Real Housewives, you do bring the glamour. Like me and my girlfriend, she was just in here, the CEO of Skinny Confidential. She loves you because there is this glamour and glitz that like everyone wants to look at and absorb that you bring to Orange County, and without that, it would not be the same.
Well, I appreciate that.
And
plus,
the logic.
one of the other housewives mentioned that maybe she doesn't fit in because she's a little more liberal than what you typically see conservative wise.
Oh, I just saw that.
Yeah, and
Oh.
and by the way, that's
Well,
exactly
what do you mean?
who you want on the show.
The thing
Someone
is,
who's
you
different.
don't want a show that's like 6 cookie cutter of the same opinion, the same looks, the same everything. That's so boring. The whole point is it's intersections of people that live in an area and who they are. And by the way, the bottom line with our show is it is about conflict and resolution between us, our relationships, our friendships, and you want differing opinions.
I also think to that person's what she said, I think I'm not watching the show for anyone's political opinion. And to be honest,
definitely not.
I don't really care about anyone's political opinion, left, right, whatever. You're watching it for me, like I'm watching it to like
I want to know
be
who's flipping the
entertained
table
and
over.
check out.
Right.
That's what I
Yeah,
want.
so I don't think that matters what anyone's political opinion is.
It doesn't. But everyone's trying to get clickbait for their show.
Or
I think
get
a lot
back
of that's
on the
kind of
show.
going down now. People have really, I think, got fatigue with that, with like all the political stuff 24/7.
Right.
It's always like we're talking about this. Like I don't want to pull the political thread through.
Right. I mean,
in what
this
we're
is
talking about with plastic surgery and GLP-1s, but somehow people do, right?
That's true.
But this is
It's nuts.
escapism. It's exactly what it's
Yeah.
for.
Yeah.
It's why it's so popular. You want to be able to turn on the TV and half the audience is like, oh, I want to be her. And half the audience is like, woo, glad I'm not her.
Who is both of your favorite housewives personally on any franchise? Like who do you guys like?
I mean, well, we just had dinner with Crystal Minkoff and Rob Minkoff.
Yes.
Really good friends.
But I'll be honest
Cynthia
with you.
Bailey.
Crystal's
I
been on
love.
here. We like her. Very
So-
much.
Marcel's a good friend.
So I kind of protect myself. I don't watch the show, so I don't know what conflicts they're having during the season. So when I appear on the show, to me, they might all be fighting and liking or not liking each other.
That's smart.
So I go, hey, I actually like all the Orange County housewives.
How are you
I
guys
like 'em all.
both so logical in such a chaotic atmosphere?
Well, listen, there's definitely times, during filming that I am not.
I feel like there's a stoicism, like a calmness about you where they're all spinning and you're able to like be logical and not emotional.
I mean, mostly, yeah, but there was, I guess I was sort of calm then too. But, I would tell you like season 17 maybe, where that was the season everyone was kind of
Man, I can't
jumping
believe it's
on
been that
top of
many.
me.
season?
20
Remind
is
me of
next
what
season.
happened in
It
the
was
season.
like,
Wow.
everyone was, it was the year we sold our house. It was that year.
Okay.
And everyone was kind of like
That's-
jumping all on
that
top of
doesn't
me and
surprise
not
me.
being nice and all those things. And even though in person I was really calm because it was just all, I was trying to figure it out and it was all so weird to me. But at home, I mean, I was devastated.
Yeah.
It was so hard.
Yeah.
Meaning you were devastated with how they were treating you.
Yes.
So when you get off work and you come home, it still comes through to the house.
Oh.
Of course, because
Draining.
you cannot sit at a dinner with a bunch of women who are, lambasting you for things you didn't do or twisting things you've said. And I know a lot of us go through this, not just me, but in that particular season, this was me and it was just so devastating. Now, the flip side of it is I do always say, and I am very cognizant of the fact that at the end of the day, I get to go home. And that was never going home to my big fancy house or this or that. I get to go home to my husband. I get to go home to my children and to this life. So it doesn't really matter what they are saying about our marriage, our money, my family, whatever it is. It sucks and it hurts and but when you go home, you go, oh yeah, I'm home.
Yeah, but one of the things that makes you such a great housewife is
Because I can't help
the
myself.
authenticity of
Yeah.
it. She's sensitive, she says what she means, and she's kind. And
But I get my feelings hurt
She
really
gets her
easily.
feelings hurt, and that's one of the reasons they go. They know that they're going to get a reaction out of Heather.
But you know why I also
So they
think
go for the jugular.
you guys have been so great and done so well is that you guys, from what I can see, we meet a lot of people, have a rock solid relationship. Where
Oh,
I
yeah.
think a lot of people that go on these shows, they go in with the relationship maybe not being, and we've had people come on and admit to that, not being so solid. And then they get thrown into that environment with the world judging. And I imagine that is very hard to
I
manage.
think it polarizes whatever is currently going on in your relationship. Having said that, you go through things. I mean, we had one really bad year on the show where off camera we were just not getting along and really fighting. And it was because of the stress of the show. And we had to have a sit down, come to Jesus moment and say, look, we either have to figure this out or we're getting off the show.
I think though, in every marriage that's been 20, 27 years, there's rocky points. And I think people can relate to that. I mean, it's not, if you're going to be married for 27 years, you have to expect some challenging times.
Right.
And I think the audience, as a viewer, again, I like seeing that authenticity. And then you guys always, to me, come out of it.
No, but I
Yeah.
guess what I'm saying is like we've had people on these kind of shows come on and they've said, hey, like the marriage was bad and we thought doing the show would repair it.
It's like having a baby.
And they're like, we do, yeah, exactly.
Yeah.
And they're like, we'll do the thing and that'll make everything okay. And then it just makes everything way worse.
Yeah,
Definitely.
Yeah, definitely.
I would love to round out and end the show with you guys telling us why you think and what the secrets are of being in a partnership like you have for 27 years. I think there's a lot of takeaways for our audience with that.
Well, first of all, we met on a blind date. And in December, it will be 29 years from our blind date.
Really?
29.
You didn't even know that?
I know the anniversaries.
29 carat ring.
She still wants a
It's
gift
not 29.
for the anniversary of our first date. Okay.
I find that anniversary to be more important than the wedding date.
Okay, so my first date was when we were 12. So what do I get?
Yeah.
Wow.
You've been together a long time.
We have not been
Not
together
since
the
we were
whole time.
12.
Oh.
But since
I
we were
know-
20, so almost 20 years
Yeah,
now.
so what do I get?
Because
That's great.
the moment you're
Okay.
together, to me, that's what changed the trajectory of your relationship. So even though like on our wedding anniversary, we go to dinner, we say something nice, whatever, we don't usually we usually take a trip.
Yeah.
For our wedding anniversary. But like the blind date anniversary, it's like, that was the moment.
Did you hear that?
That's the moment.
So what are
Like,
the
what if we
secrets?
hadn't gotten married for 15 years? So it's only, we've been together 5 years? Like,
Yeah,
what-
I agree with her. What is
Wait,
the
but we didn't meet on a blind date.
No, but we met when I was 12, so start adding it up.
at least start from 20.
Yeah, at least. At least.
I could do from, because there were some rocky patches there between 12 and 20.
Yeah. I say
Yeah,
to
puberty.
split
There were
the
some
difference,
in-betweeners.
and let's say 20. Yeah.
So what do you think makes your partnership so rock solid?
I think that for me, I mean, first of all, we're best friends.
Yeah.
We really are.
You could tell you like each other.
Yeah.
We love each other. I mean, we like each other. We love each other. We really respect each other.
Uh-huh.
And look, we've 29 years. Good days, bad days, good years, bad years. That is just the truth. We had I don't want to get too into it, but we had a thing a few weeks ago where we got into an argument and it went really south. And we were very polite to each other for 2 weeks. And then we had this big conversation and da da da. But coming on the other side of it, I said to him, I think last night, I was like, that sucked so badly. Because when I'm upset or I'm happy or whatever, I want to call you, but I'm mad at you. But as much as that sucked, when you come out the other side of something like that, you're so much closer and you go to like the next level. And sometimes that just needs to happen. And maybe there's things that, you know, are bugging you or whatever, but you don't bring them up because it's not really worth it. And then sometimes, you know, you clash and it all comes out. And that happens. And it's how you get through it. It's how you learn how to fight with each other, how you make up, and how you really then need to let it go.
It's a big accomplishment to be together as long as you guys have been. It's very rare.
I've noticed that a lot of celebrities
Are divorcing now.
right at this stage.
Yes.
Like at the stage that you guys are at?
Keith Urban,
And Nicole Kidman.
Oh, that's an
and
interesting
Lori
observation.
Loughlin and Massimo.
Hugh Jackman.
I didn't know that.
Hugh Jackman.
Almost
is-
exactly at this point.
Yeah.
Yeah. I think there's that
There's
7-year
certain
thing.
inflection points,
This is
right?
an inflection point, I
Yeah.
think.
Do you think it's in a
Careful. No.
maybe this is a question for I was thinking about some of those. Do you think it's when the kids start to kind of like leave and they become
That's a
empty
big
nesters?
inflection point for
Yeah,
sure. 'Cause
that's
then
a
you're
big
left
deal.
with yourselves.
Right.
We've always been really good at dating each other and prioritizing our marriage. And I mean, look, I love our kids. We have great kids. But, you know, he jokes like he's ready. We have 3 gone, 1 in high school. He's like, the other one could go. Like, we're ready to be empty nesters. Go, go, go.
True.
But he's saying true. But I mean, it's not that I want to kick him out, but it's like we are now seeing the
Ready-
light
ready to
at
phase.
the end of the tunnel. This is our 4th time going through high school, and we're ready.
So my advice, my thing is that you have to, it's all about your expectations, right? You should expect to have challenges. And then when they happen, expect, if you try, that this too shall pass. You know, I love that phrase. Even with the good stuff or the bad stuff, this too shall pass. Don't expect it to stay the same. And you have to learn how to evolve through it. And, you know, a lot of it's chemistry. We have very good chemistry. I know you guys obviously do too. But like when we get into a thing, I literally forget about it the next day. I can't even remember what it was about.
And I'm stewing.
And she's stewing. And so the thing that bothers me most about fighting is I know she has her process that's going to go 2 weeks. I'm going, oh, I'm screwed for the next 2 weeks.
Yeah, that's you. It's like okay, that's like I can move on in 20 minutes. I'm like, this is going to be a 4-hour morning of this, but I'm not
Yeah.
even really upset. I'm just like, I
all
gotta.
you guys both have to do is say yes, dear. It's that easy.
Oh,
Yes,
really?
dear.
No.
She asked me the other day, she goes, why can't you like just be like, you're so stubborn, it'd be easier if you just said yes, dear. Like, how long do you want to fight for? I'm like, forever. Like, I'm just never,
Oh, you want it. You're the.
I don't want to
you-
fight, but I'm too stubborn to like,
You're digging in.
I'm digging in. I know it's at my detriment. I'm like a masochist or something. I know
But you
it's not
got to
smart.
choose those battles.
Yeah,
Yeah.
I do. I don't,
So-
but I do
So
let
give him
things,
advice.
I won't dig in.
Give him that advice.
And also, I think our dynamic is I will never, I let things go like immediately.
Yeah.
Once it's done. I'm like,
I
when
think it's a Mars Venus thing, honestly.
And she hangs.
she
I'm
she
not
hangs.
letting stuff.
hang.
You have to not let stuff go because then you have to create a boundary. It's like a dog. You have to like.
If
you have to
anybody gets a hold
reprimand
of our
them,
text
or they
threads when
keep
she's
doing
mad,
it.
they're gonna be like,
Yeah,
oh,
the text threads
Oh,
are like.
ours too.
it's like a machine gun of
Yeah.
text.
The
and I'm
other
just like-
day I
just,
used
okay,
ChatGPT.
got it.
I was like, hey, chat, this is what my husband did today. He pissed me off so bad. How would you respond to really nail the point across? ChatGPT worked on a fucking response for me. I sent that
My
response.
response is like, okay, got it. Sorry. Can we move? Like,
We did that once as a
That's-
joke, remember?
Yes.
Yeah. That's so funny.
But
go
sometimes
ahead
we
with
do,
the
we
secret
do
sauce.
fight sometimes. Sometimes, you know, the tone is not good. So if you separate and start texting, it can be better because
See?
it takes some of the tone out of it.
oh no, she's got a good tone in her text.
Yeah,
I can see. I
sometimes
can
you can
hear her
infer
voice
tone in text.
through the text.
Yeah.
Yeah, okay, fine.
My least favorite word is sure.
I also have another hot
God.
tip. If he annoys me so bad, I've blocked him.
Wow.
I'm a savage.
You blocked him on
Wow.
Instagram?
No, I
like,
blocked him on
her-
text.
No, her text. She'll block
You
my
could
phone.
do that?
Yeah, you can block him.
So I can't even get a hold of her. It just goes to, like the text
Oh yeah.
goes green.
I will.
The message
I will
won't
go.
through.
I'm like a firefighter.
Yeah, by the way, he would never know be able to figure
Oh,
out.
you couldn't figure it out.
No.
If I did that,
he would need
you
one of our.
that would
By the
light
way, if
you
I
up.
blocked-
that would
If
not
I
be
blocked
good.
you, you
No,
would
no, you
lose
can't
your
block me.
shit.
That's why, every once in a while they're like, everyone on Housewives, they say their husbands are cheating on them. We all get that. So they were saying about him once, and I'm like, do you know my husband? If he were having an affair, I would have to book the hotel. I would have to make sure his sleep mask was there and a fan was in the room and there were blackout shades. I'd have to call and make sure he has room in his surgery.
It's
It
true.
would never happen.
I walk around life like
he
this.
has a fan in his room at night.
Yes.
He
By
has to
the
have
way,
fans.
so do you.
We like it snowing in the room.
Okay.
Cold.
Fans
That's healthy.
and
Air conditioning
snowing
on.
and electric blanket.
Oh, electric blanket.
Yes,
But you want
only
a
on
cold
my side.
and hot. Why don't you get an 8 sleep?
A what?
An 8 sleep. They would give you guys one of those.
What's that?
Oh my God, it's the best thing. It's a mattress cover and it puts water through and you don't feel the water. But it adjusts cold and hot. So in the night,
guys would
it
like
makes
that.
it really cold. And in the morning, it wakes you up with warm. And you could set it to warm the whole night if you want. So you don't even need an electric. It puts you.
It cools your body temperature.
We also like the moving air and the white noise of it all.
Yes.
They like the movement. I totally get what you're saying. They like the movement of the fan
Mhm.
Yeah.
I
and
get
the sound of the fan.
Yeah.
But an 8 sleep is good too.
Mhm.
I like it because you can program different sides for what if he likes this.
That's
I
Well,
like
that's
good.
what we do too. So I've got my heating blanket on high,
And I have
his
it
is
off, and I have a
he
leg over.
Yeah, puts his leg.
And then I go, oh, that's a little too warm. And I go like this.
No, but I think I see a lot of our friends that are our age now that are still single. And they like nitpick at the littlest things sometimes in a relationship. And it's like if
Ooh.
one little thing goes wrong, it's like not out to the next. I'm like,
Ooh.
it's not always, there's problems with every other, like my philosophy is like grass isn't always greener. You're gonna have to deal with another round of issues with another person. It's like we put in so much time, let's just work through it.
But
Well,
that's
that's
very
it.
good advice. You don't sweat the small stuff. And it's easier said than done.
Yeah.
But just when they do that thing, just go, be the Hot for Teacher video. You probably don't know what that from Van Halen, where the kid starts the video like this. Just do that and let it go. And because it's not important anyway.
Well, between the two of you two, it's never boring. I can tell you that after interviewing you. It's never boring. That's how you keep it spicy. Where can everyone find everything you're working on? Your skincare line? Tell us about your new YouTube show, your books, your podcast, everything.
Yes. So our podcast is called Between Us. It's on iHeart or wherever you get your podcasts. Then our YouTube show is going to be exclusively on my channel. So if you just go to Heather Dubrow, you subscribe, please. And it's coming, I don't know what the drop date is, but it's coming out in a few weeks, the first episode. And it's really fun.
What's it called?
Oh, and it's called Dr. and Mrs. Guinea Pig.
Cute.
Yeah.
And
Dr.
you
and
guys
Mrs.
are
Guinea Pig.
funny together on TikTok and Instagram.
Well, our kids don't think so.
Oh, we're so cringy to them.
And
And
you're gonna
speaking
do
of
all
funny-
the like. What are the things you're gonna do outside? Like
So
you're gonna try an AD.
Creatine,
Okay.
Okay.
weighted vests, NAD, peptides,
Okay.
Mhm. Bad breath treatments.
bad breath treatment.
Sunscreen.
We're going to do crash diets.
Okay.
That's going to be hard.
Are you gonna do the
We're gonna
NAD IV? Are you gonna
Oh,
do it?
yeah.
Oh, good luck.
Why? Because it makes you feel like you're going to shit your pants?
No, it does. I keep telling you, it doesn't
I
feel
need
like
that. That's fine.
But
Ooh, I don't know. Michael said it like, what does it
No,
do?
it just feels like someone. Well,
Yeah.
here's the thing. It's weird. It feels like they're squeezing your stomach, but I've had different reactions. One time it felt like that. One day I got really congested in my
yeah,
face.
it's a histamine response.
I have a friend that's
yeah.
got a jaw thing with it too.
Yeah.
Yeah.
I try to do it fast though.
I'm going to let you guys be the guinea pig and then I'll just do whatever you guys tell me to
because
do.
it doesn't
Perfect.
feel well.
Yeah.
So I
That's
wanted
it's
to get it
like
over
our
with.
pain
Really?
for your pleasure.
Yeah.
We're gonna try it out so we'll tell you.
But we're subjecting it to real clinical science.
Yeah.
I feel like that's
Like-
another Netflix series or something.
Could be. Oh, and resistant carbs.
We did resistant. You
Yeah.
heard about this?
What's that?
So you ever heard about resistant? So carbohydrates break down into sugars. And
Okay.
sugar's bad, right? So there's this theory called resistant carbs that if you take a carbohydrate like bread and you heat it to make it, and then you cool it down, it changes the molecular structure of it.
So it has less carbs, less
So
calories.
it's harder to digest, but it tastes the same way when you reheat it, and it has a lower glycemic index. There's less glucose, and the calories are less. That's what they say. We're testing that.
Yeah.
We did test it, by the way.
Yeah, but you have to wait. You have to
Yeah,
subscribe
that one I'm
to
excited
Dr.
about.
and Mrs.
That
Guinea
one's
Pig
good.
on Heather Dubrow YouTube channel.
We're going to tell you how to eat your carbs and manipulate your carbs
Yeah.
so they taste the same.
Because here's
But you
the thing.
absorb
We
less.
go out to dinner with people. We get DMs all the time like, what are you doing for this? How do you do that? You can't answer everyone. But then we started talking about it. Because obviously we talk amongst ourselves. What do we want to do to stay young, healthy, longevity, all the things. So now we're just testing them all and showing you.
I mean, after 4 children, I want to look like this. So I
Thank
will
you.
definitely be watching.
So we're gonna go to 4.
Oh, I don't know. That you
Ooh.
just, I have 3. She has 4. I'm
No,
saying
it's- but-
after 4 children, if she looks like this,
But
But
she's
I'm,
doing
saying, but
something
I'm
right.
hearing that we could go to 4 then.
It
That's
sounds
what I
like
heard.
you
in my
had the
head.
opportunity to have your tubes
And
tied
then you could-
properly.
then
You
you
didn't
could
do
have-
it. You were asked, weren't you?
Then you can avoid the middle
Did you have a
dynamic.
C-section?
I had vaginal births.
Oh.
I don't have Ozempic vulva
Not yet.
at this moment.
But there's plenty of time.
There's still time.
Thank you guys so
Thank you
much for
both.
coming on the
Thank
show.
you.
Come back anytime you want.